Thank you for joining us for the St. Louis Metropolitan Pandemic Task Force Daily Briefing with Dr. Alex Garza. The briefing will begin shortly. Dr. Garza will take questions that have been submitted by members of the media after he makes brief remarks. Reporters who have questions during the briefing may also submit those to the Task Force Public Information contacts, and we will attempt to address them during the briefing or as quickly as possible after it concludes. I'll now turn the briefing over to Dr. Alex Garza. Thank you.
Okay, thank you and good afternoon, everybody. Thanks for joining us on this rainy afternoon. We have a couple of bits of data to look at today, so let me get to that information. All of this will be very useful as we try to navigate that first wave of the pandemic and begin to look at reopening our economy while keeping that reproductive or that transmission in our community as low as we possibly can. So let me get to the data for today. So currently we have 702 patients that are hospitalized within the task force hospitals. That's up compared to yesterday where we had 678. And again, that number will fluctuate daily, but we keep our eye on the trend over time. And I'll show you an updated chart with some of that trend data here in just a second. And also remember that these are patients that are COVID positive plus patients under investigation, so we're waiting to see what their test results are. There were 160 intensive care unit patients, which was about the same as yesterday at 159. And then we had 121 patients on ventilators, which was up from 113 yesterday. And of course, we always like to show our slide about discharges. So we had another 42 COVID patients discharged yesterday from our hospitals, which brings us up to 1,209 patients that have been discharged since we had our first case of reported COVID within our region. So now let's talk a little bit about trends. You heard me mention this in the previous slide. This is really important as we try to understand what the reproductive rate or how we're performing or what the spread is like in the community. And this gives us a reasonable approximation of what that looks like. It's delayed data. If you think about it, people become infected, then they have to become symptomatic, and then they reach the hospital, and that's when they hit our graphs. So it's a little bit of a delayed signal, but still it's a good signal for us to use to understand what's going on in the community. Because testing capacity remains an issue both here locally as well as nationally, we believe our hospitalization data is a better indicator of what the status of the virus is. But we are pretty confident that our testing capacity is going to be growing into the future. I think, as I mentioned yesterday, I was at our local lab here, and they felt confident as well that the testing capacity was going to continue to grow. And I've heard from other testing partners within the state that has also continued to grow. So this slide shows the moving average that we showed yesterday for the first time. And it, again, includes those confirmed COVID positive patients and patients under investigation that we show every day. And so this chart is showing that the number of patients is still elevated from where we started in early April up until around the 21st through the 24th. On that 7-day moving average, it was higher than 700. It's been down a little bit over the last couple of days, around 681. While the trend line looks pretty flat and steady, today's hospitalizations, as you remember, is still significantly higher than when we started this back on April 5th. So we're encouraged by the data, though, because as you can see on the curve, it was coming up and then it sort of flattened, and we're seeing that continue through the remainder of this week. And really the reason for that is because of all the tremendous work that's going on in the community with our public health partners, with the elected officials, really putting forth all those policies, planning, and then all of the people in the community responding to flatten that curve. And so it actually is it's nice to see, and it's a credit to everybody's hard work. It will be really critical, though, to continue to follow the guidance that everybody has put out. So as you can recall, we want the curve to come down, and that's dependent upon what happens out in the community, the transmission in the community. And so as we look forward to this curve coming down, a lot of that is dependent upon the transmission that's going on right now amongst the people within the community. And so that's the end of our data presentation, and now I'd be happy to address some questions from the media.
Reporters heard reports of some healthcare workers testing positive for the virus. Do you have any information on how they contracted the virus, as well as whether they are infecting loved ones?
We know that healthcare workers do contract the virus, and so, whether that is through community spread or through contact with patients, it's really hard to tease that sort of data out. But we also know that the number of employees, of our healthcare providers, of our staff that have been infected is a pretty low percentage compared to our entire employee population. Our staff, our workforce is very well in tuned with this disease, and we've taken steps to help them as well in protecting their families. So if somebody either feels, if they've been working with COVID patients and feels anxious about going home, we've provided housing for them so that they wouldn't have to expose their families, as well as if people needed to quarantine away from their families. There's safe avenues to do that as well.
This reporter's heard that there are some discussions about a form of widespread testing to gauge the extent of infection. Mm-hmm. Do you have any information about whether the task force or some other entity will be conducting any form of widespread testing?
What they're talking about is a prevalence-based study, and so there's been numerous studies that have been in the media here lately. You probably heard the ones from New York, from LA, countries like Germany, other places. They've mostly done what's called seroprevalence studies, so looking for antibodies in the blood. The state of Missouri has embarked on a prevalence study, although it's more of a focused prevalence study, so they're looking at certain areas of the state. And then there has been discussion within the St. Louis region as well as doing the same thing. So then the question is, should it be a PCR-based study, which is looking for active infection, versus a seroprevalence study, which is really looking for prior exposure. And so those discussions are ongoing with public health right now.
Jefferson County and St. Charles County have both announced that they plan to follow Governor Parsons' reopening plan on Monday, May 4th. Mm-hmm. What have you seen in any hospital trends in those areas? Do you think those figures warrant an easing of restrictions?
It's challenging to, understand what's happening within those populations according to hospitalization data. So we're getting more and more data on, so what you really want to know is how many active infections there are in the community, not necessarily, admissions in those hospitals, because as you might expect, people from Jefferson County or Franklin County will come to St. Louis hospitals within the St. Louis metro area for their care. And so really the key is looking at the number of cases that occur within those communities. As I've mentioned in the past, we've developed a plan to pull all of our data together, BJC, SSM, St. Luke's, and Mercy, so that we can start getting that granular level of data on who has been hospitalized and where do they come from. And we expect to have that up and running, I believe, by the end of the week.
Do you worry that easing stay-at-home orders in much of Missouri on May 4th will undermine the St. Louis region's efforts to slow the spread of the virus?
Well, anytime you do something that increases the probability of transmission, you're always worried about the number of cases that come along with it. And so, of course, you would be concerned that steps that have been that are taken, where people are in contact with each other more and more, that does increase the probability of transmission. So, but really the key is how do we reduce the rate of transmission? And those are things such as making sure we're still following social distancing rules, making sure we're doing things like washing hands, keeping surfaces clean, wearing masks out in public, things like that. And then also that public health response with testing people that are sick, doing contact tracing, isolation and quarantine. So the question really isn't hinged as much about that opening from those different counties. It's what are those mechanisms that we have in place to really control spread. You can control spread while opening the economy. You just have to make sure that you're doing it well, and the community has to be invested in that process of doing it well. It's really incumbent upon everybody.
Do you have a sense of when St. Louis area hospitals will be able to resume elective surgeries?
A very difficult question to answer. And so, uh, in some ways, it mirrors sort of the reopening of the economy. So, of course, we want to see the number of COVID patients in our hospitals coming down at a steady rate as well. We want to make sure that our workforce is going to be able to handle more patients coming in. We want to make sure that we have personal protective equipment because, as you can imagine, when you're doing surgeries, that takes up personal protective equipment. And so you want to make sure that you have enough supplies in order to take care of all of those. And then lastly, on the testing front, you want to make sure that you're able to test people as well that are coming in for things like, knee surgeries and stuff like that, because you don't want to bring somebody who could be an asymptomatic person who's infected into the operating room and potentially expose, the workforce. So there's just like reopening the economy, there's a lot of building blocks that need to be put in place before we'd feel comfortable by saying, yes, let's start doing elective surgeries.
Are there regional projections for what could happen to our COVID caseload as restrictions are either lifted or loosened?
The question really isn't about the restriction. The question is about transmission. So as I mentioned previously, you can reduce the restrictions if you do a very good job of keeping transmissions low. And so that's really the question. So so for instance, if we went back to the way life was before COVID started, with absolutely no social restrictions, people interacting, large gatherings, things like that, absolutely that will drive our case rate up. No question about that. So the answer to that question is really dependent upon what sort of mitigation efforts do we have in place to keep the transmission number low. If you can do that through the public health measures and through all of the social distancing rules, then it is possible to open more of the economy and more of society. But the key is to keep the transmission rate low.
Is there expected to be a second bump or a peak? And are there estimates that quantify how large that could be?
So again, it's all dependent upon transmission. So and I hate to sound like I'm beating a drum here, but I am. So if we approximate that the transmission rate is going to go up, then our models show cases going up. It's that simple, and it's all based on probability of infection, which leads to cases. So of course, as healthcare systems, we're very concerned about a second peak, and we're concerned about increased transmission rates. And so it's incumbent upon us to sort of draw that out. So if that transmission rate increases by so much, what does that mean on the back end? And that's really no different than when we were preparing for the initial wave, when we were modeling these things out. What should we be expecting? What should we be planning for? What sorts of things should we be advocating for to keep the transmission rate low?
When you talk about models and projections, who produced those?
So there's a group of data scientists. So I'll again take us back to when we first started forming this task force. We brought together our analytic power between SSM, BJC, Mercy, St. Luke's, WashU, St. Louis University to come together to build these models. And those are the models that I've shown you repeatedly on our press conferences. And so that is the group that we have tasked with taking a look at all of these different scenarios to give us a best estimate on what we should be planning for. And again, it's incumbent upon us to be prepared to take care of these patients. So we have to be able to understand what is the projected caseload that we could be thinking about. It's really important for us as sort of the receiver of, if there are increased cases, to be able to provide that in a safe environment.
Have there been examples of second waves in other places? And if so, what lessons do those places offer that our region can and should take into account?
So you've seen me show the slide of the 1918 pandemic. So there's one in St. Louis, and it was correlated with reopening the economy. So that second wave came along because of that. One of the more timely ones, though, is the second wave that occurred in Singapore after they had really blunted their first wave. They were really a model of how to do that. But what they learned from that is it was areas of concentrated transmission. So it was young construction workers that were living in very densely populated areas where the spread was occurring. And I think that the lesson learned from that is as we become better at identifying where transmission is occurring, that we can then focus efforts on those areas to really drive transmission down. If you think about it, there's some areas in the community that are more at risk for spread, whether that's from urban dense living rather than more rural dispersed populations, people with more comorbid disease, things like that. That if we have good data that says this is where it's occurring, then we can react faster and try and drive transmission down.
The FDA plans to announce as early as today an emergency use authorization for remdesivir. What is your reaction to that news, and would it be a treatment we could see in the St. Louis area?
So my reaction to that is that it's good news. There was some preliminary data that came out that was very promising. I think most people saw or heard Dr. Fauci yesterday talking about some of the outcomes from those studies, and they were very promising. And so it's another useful tool for treating COVID patients. Was originally developed to treat Ebola patients, and then was brought off the shelf to see if it worked for COVID patients. And thankfully, it looks like it has a lot of promise. And so there is opportunity to use it in the St. Louis hospitals.
Is it safe to assume the decline in patients on ventilators is because those patients have died? If not, can you give us the percentages on patients on ventilators who survive and those who died?
So that's not a correct assumption. In fact, the opposite is actually true. Because we've been learning a lot of what works therapeutically from other regions that have been hit really hard, reading in medical journals, and frankly, a lot of discussion between clinicians, we have improved our therapy for COVID patients. And so what we're actually seeing is patients that potentially early on in the pandemic would have most likely gone on a ventilator are now not having to go on the ventilator because of different techniques that we're using, such as proning and high flow nasal oxygen, things like that. And so actually the reverse is true, that there's less patients actually going on ventilators because of that. I don't really have the statistics for mortality of people that are on ventilators or not.
Is it a safe assumption that every patient who has died from COVID-19 was on ventilator care at some point?
No, I wouldn't be able to answer that precisely, but my overall answer would be no. People die in the hospital every day, and not all of them are on ventilators. There's a lot of other things that go into whether somebody lives or dies, and it's not just primarily dependent on the ventilator, including people that have living wills and other sorts of things. So it's not there is no common pathway for when somebody dies of COVID.
You said yesterday that you thought the decline in hospitalizations was coming soon. When the downward trend occurs, what number of hospitalizations would you expect to see it decline to?
tough question to answer, and I think it depends on day. Overall, we expect the trend to keep coming down. And so how fast it comes down is entirely dependent upon transmission in the community. So again, you'll hear me go back to transmission. So if the transmission remains low, that means less infections, less people in the hospital, and there will be a steeper decline in time. Now remember, the trend that we're looking at now going forward is from infections that happened, 7, 10, 14 days ago, because that's how much time it takes to develop symptoms, get admitted to the hospital, stay in the hospital, eventually get discharged. So we're taking care of patients that were infected, up to 2 weeks ago. And so that rate of decline is dependent upon what that transmission rate was 2 weeks ago. So I guess the takeaway point is if we as a community want to see that trend continue to go down, then it's incumbent upon us to keep that transmission rate low by following all of those practices that we've been following for the last 5 weeks.
Thank you. That concludes the list of questions received from members of the media prior to and during today's briefing. In the morning, we'll accept questions from members of the media for tomorrow afternoon's live stream. Thank you for tuning in.